Hey everyone, welcome back to Doggy for Life. Today we're talking about something incredibly important for every dog owner: what happens when our beloved furry friends start getting old. Aging is a natural part of life, but it can be a difficult transition for both dogs and their humans. Sometimes the changes sneak up on us, and we might not realize what's going on until our dog starts acting differently or facing new health challenges. That's why it's so vital to understand the signs of aging and how we can best support our companions through this phase. By knowing what to look for and how to adapt, we can make our dog's golden years truly golden, full of comfort, love, and dignity. So grab a cup of tea, get cozy, and let's dive deep into what you need to know about caring for an aging dog. Number 1. Slower movement and less energy. One of the first things you might notice as your dog ages is a clear decrease in their energy and mobility. The high-speed zoom eyes that once made you laugh might become less frequent, replaced by slow, measured steps and longer rest periods. This slowing down is often due to the natural wear and tear on joints, muscles, and bones. Many senior dogs suffer from arthritis, a painful inflammation of the joints that makes movement difficult. Imagine trying to get up and move around with stiff, aching knees or hips. That's what your dog might be feeling every day. Number 2. Changes in sleep patterns. Aging dogs often sleep more during the day, sometimes 18 hours or more, but their nighttime sleep can become fragmented and restless. This change in sleep patterns can be confusing for owners who wonder why their dog is suddenly pacing at night or whining in the dark. Some of this restlessness comes from physical discomfort like arthritis pain, but it can also be a sign of cognitive decline, sometimes called canine dementia or cognitive dysfunction syndrome, CCDS. Much like Alzheimer's in humans, CCDS can cause memory loss, confusion, and anxiety, especially in unfamiliar or quiet environments. You might notice your dog getting stuck in corners, appearing disoriented, or waking up frequently. Number 3. Reduced senses. Another common sign of aging is the gradual loss of vision and hearing, which can dramatically change your dog's behavior and confidence. You may find your dog doesn't come when called or startle easily because they can't hear you approaching. Their eyesight might be dimmer or blurred, and they might bump into furniture or walls that were never a problem before. These sensory losses can make your dog feel vulnerable and less sure of their surroundings, leading to anxiety or clinginess. It's important to help your dog adjust by keeping your home environment stable, don't move furniture around too much, and provide clear pathways. Verbal cues combined with gentle touch can help guide your dog safely. For example, before petting or picking them up, let them know you're there by speaking softly or tapping nearby. Number 4. Changes in appetite and weight. As dogs age, changes in appetite and weight are very common, and they can be signs of underlying health issues or just the natural slowing of their metabolism. Some senior dogs lose interest in food because of dental problems, like painful teeth or sensitive gums, that make chewing uncomfortable. Others might find food less appealing because their sense of smell and taste decline with age. On the flip side, some dogs gain weight as they become less active and burn fewer calories. Both scenarios are concerning because excess weight puts added strain on joints and organs, while weight loss can indicate serious problems like kidney disease, diabetes, or cancer. Number 5. Behavioral changes. When dogs get older, their personalities sometimes change, and it can catch owners by surprise. Your once lively, playful pup might become more withdrawn or less interested in socializing. On the other hand, some dogs get more clingy, anxious, or even irritable. These behavioral shifts often stem from physical discomfort, such as arthritis pain, or cognitive decline that affects how they perceive their environment. For example, a dog who is in pain might snap or growl when touched in sensitive areas, which can be confusing or upsetting if you don't realize what's causing it. Dogs experiencing dementia might get anxious about being alone or confused about familiar places and people, leading to restlessness or vocalizations like whining or barking. Number 6. Bathroom changes. One of the most challenging aspects of aging for dogs and their owners is a change in bathroom habits. You may notice your dog has accidents in the house or needs to go outside much more frequently. This isn't a sign that your dog has forgotten their house training. Instead, it's usually due to weakening bladder muscles, urinary tract infections, or other health issues like kidney disease or diabetes. Cognitive decline can also play a role by making it harder for your dog to communicate their needs or find their usual bathroom spots. Number 7. Maintaining dental health. Dental problems are one of the most common but overlooked issues in aging dogs, and they can have far-reaching consequences beyond just bad breath. Older dogs are more prone to plaque and tartar buildup, gum disease, loose teeth, and painful infections. These issues can make eating uncomfortable, leading to weight loss or poor nutrition. Worse, bacteria from infected gums can enter the bloodstream and affect vital organs like the heart, liver, and kidneys, putting your dog's overall health at risk. Preventing dental disease starts early with regular teeth brushing, but it becomes even more important as your dog ages. Providing dental chews, toys designed to reduce plaque, and scheduling professional cleanings with your vet are excellent ways to keep your dog's mouth healthy. Watch for signs like reluctance to eat, drooling, pawing at the mouth, or bad breath. They often indicate dental pain. Keeping your dog's teeth in good shape improves their quality of life by allowing them to eat comfortably and avoid painful infections. 8. Senior dogs need special diets and nutrition. As dogs age, their nutritional needs change dramatically, and feeding them the same diet as when they were young can actually harm their health. Senior dogs often have slower metabolisms, reduced activity levels, and different digestion capabilities, meaning they need fewer calories but more of certain nutrients to maintain muscle mass, joint health, and organ function. Commercial senior dog foods are formulated to meet these needs, often including higher quality proteins, added fiber for digestion, antioxidants for immune support, and supplements like glucosamine and chondroitin for joint care. However, every dog is unique, so it's important to work closely with your vet to select a diet tailored to your dog's health status. For example, dogs with kidney problems may require diets lower in protein and phosphorus, while those with weight issues may need calorie-controlled meals. Also, don't forget about hydration. Older dogs may drink less water or develop kidney issues, so encourage regular water intake by keeping fresh bowls available and even offering wet food to increase moisture. Transitioning your dog to a senior diet gradually over 7 to 10 days can help avoid stomach upset and encourage acceptance. Remember, good nutrition is one of the most powerful ways to extend your dog's quality and length of life, so investing in the right food is truly an act of love. Number 9. Regular vet checkups are more important than ever. When dogs get older, regular visits to the vet aren't just important, they're absolutely essential. Aging dogs are at higher risk for a wide range of health issues like arthritis, dental disease, kidney problems, heart conditions, diabetes, and cancers that may not show obvious symptoms until advanced stages. Early detection through routine exams, blood tests, urine analysis, and sometimes X-rays can catch problems before they become serious or painful. Your vet can also adjust vaccination schedules, screen for cognitive decline, and recommend supplements or medications to support your dog's health. It's common for senior dogs to need more frequent visits, sometimes every 6 months instead of yearly, so you can closely monitor any changes and adapt care as needed. Another key aspect of these checkups is discussing pain management and quality of life concerns. Since older dogs can't always tell us when they're hurting, your vet's guidance is invaluable. Keeping a health journal with notes on your dog's eating habits, mobility, behavior, and bathroom patterns can make these visits more productive. Remember, your vet is your best ally in ensuring your dog's senior years are as comfortable and happy as possible, so never hesitate to ask questions or seek advice. Number 10. Love, patience, and adaptation are the keys to happy senior years. Finally, the most important thing to remember is that aging is a journey best traveled with love, patience, and willingness to adapt. Your dog has been your faithful companion through all kinds of adventures, and now it's your turn to be patient as they slow down and face new challenges. This might mean adjusting your routines, modifying your home environment, or changing the way you interact with your dog. For example, adding ramps or stairs to help your dog reach favorite spots without jumping, using orthopedic beds for joint comfort, or giving slower, gentler pets can make a huge difference in their day-to-day happiness. It also means being emotionally patient. Some days your dog might be more irritable, confused, or needy, and that's okay. Remember, they're still the same soul who loves you unconditionally. And as always, if you found this video helpful, please hit like, subscribe, and tap the bell for more life-changing dog care advice from Doggy for Life. Until next time, give your dog some extra love today and keep those tails wagging.